My name is Shane Cox, and this is my article review, part of the final project for my class. Um, I did an article review on fears of compassion in a depressed population, implication for psychotherapy by Paul Gilbert, Kirsten McEwen, Francisca Catarino, and Rita Baeo. The general idea of this study is to show a possible explanation of why current therapies are not as effective as expected or have a high rate of relapse in depressed patients. The authors wanted to show that a fear of compassion for themselves and from others impacts how depressed patients will struggle with emotional regulation, and specifically the psychotherapeutic process. They cite a recent meta-analysis that shows there is a little difference in the efficacy between the common therapies for depression. Although drugs and psychotherapy combined has a slightly better response, it is accepted that psychological treatments have a success rate of about 50%, coupled with high risk of relapse and many patients having symptoms that persist. They posit that one of the underlying causes that therapy alone may not be as successful is there's a lack of consensus on where the focus should be for those with depression. Psychodynamic focuses on the unconscious processes, and anger behavioral therapy applies to creating new behavioral patterns. Cognitive therapists challenge dysfunctional thoughts and beliefs. A new approach is being developed that focuses on compassion for self and others. The idea is that a fear of positive emotions can severely impact the generation of positive emotion. Recent evidence shows that helping patients to develop compassion and other positive feelings is a benefit to mental health in general and has been shown to reduce anxiety and depression. They state that compassion for others, which is the effort to improve oneself for the benefit of others, has a positive influence on well-being, social connectedness. Learning compassion at a young age has a huge impact on emotional regulation and social interactions throughout a person's life. Developing compassion for others and seeking to help others versus an ego-focused identity, only doing things for recognition or to avoid being shamed, humiliated, has a positive correlation to supportive social relationships, commitment, and general well-being. Compassion and support given to others affect stress-linked amygdala processing and frontal cortical function. The aim of this study is to explore metacognitive fears of compassion in a clinical population. They are looking into a connection between self-criticism, self-compassion, and the impact to depression, anxiety, and stress. They hypothesize that a fear of compassion will negatively correlate with the ability to have compassion for others and for self, and positive correlated negative views of self and a high indication of depression, anxiety, and distress. Methods. They had 53 depressed patients. 12 came from the acute wards and 20 from the day hospitals of the Derbyshire Healthcare Foundation Trust. 4 came from Leicester Mental Health Trust. 17 from the local Derbyshire Self-Help Depression Support Group. 32 were women, 21 were men, ranging from the age of 26 to 91 years old. They used DASS scores for depression. 7.6 were classified as mild, 13.2 were severe, and 66 were extremely severe in terms of depression. They used a series of compassion scales. Each of these had a Likert scale. So there was self-reporting,